Hello, my dear students. Assalamu alaikum. Hope you are doing good. I'm Dr. Rezwan. Today, I will discuss about the second part of the cardiovascular system. In these slides, I will discuss about the end arteries and Vasavasoram. I have made this slide a little smaller so that it will be easy for you to understand the topics in details. So, let's begin. Today we will start with the end arteries. First of all, what is end artery? These are the arteries which have no precapillary anastomosis or have precapillary anastomosis, but that is not sufficient to maintain collateral circulation. This is the definition of the end artery. You can focus that there are two parts in this definition. The first part, where the arteries have no precapillary anastomosis. That means these arteries do not connect with each other before they are going to the capillary bed. On the other hand, they may have this kind of anastomosis, but those anastomoses are not sufficient to maintain the collateral circulation. So, what are the types of end arteries? End arteries are mainly two types. True end artery, also known as anatomical end artery, and also functional end artery or physiological end artery. True end artery. True end artery signifies the first part of the definition. That means artery which has no precapillary anastomosis. Obstruction in these arteries causes local death of the tissue, which is irreversible. Obviously, these arteries do not connect with any other arteries before supplying to the destinated tissue or destinated space. So if these arteries get blocked, then obviously there will be no other arteries which can give blood supply to that place. There is only one example of true end artery, and that is central artery of the retina, which is a branch of ophthalmic artery. So in this picture we can see the central artery of the retina. You can see this is the central artery of the retina, which is a branch of ophthalmic artery, and that ophthalmic artery is a branch of the internal carotid artery. And you have to say that central artery of the retina is, after its formation from the ophthalmic artery, it is directly entering into the optic nerve. As we can see, this is the optic nerve. It is placed in the central of the optic nerve, and it is coming out within the retina through the optic nerve. It is moving through the optic nerve, and it is giving supply to the whole retina. You can see over there that it is then get bunched and it is giving supply to the retina. The same thing happens over here. This is the ophthalmic artery, and this is the central artery of the retina, that is only artery that is present within the optic nerve. So this is the true end artery. Now this is the actual picture of the central artery of the retina in the retinoscope or ophthalmoscope. As we can see that this is the retina, and this is the central artery of retina, which is now branched to supply the whole retina. This is the central artery of the retina. It is supplying the retina. Now what is functional end arteries? These arteries have precapillary anastomosis, but that is not sufficient for maintaining collateral circulation. What is collateral circulation? The thing is that if any arteries get blocked, then if that artery is having connection or anastomosis with any other artery, then that extra artery can help this artery to maintain the circulation, and that is called the collateral circulation. It is also known as bypass circulation. So this kind of functional end arteries are present in the certain areas, especially the coronary arteries that is present in the heart, cerebral arteries present in the brain, branches of superior inferior mesenteric artery. You will study this artery in the abdomen. Then the nutrient artery of the bone, we already know this nutrient artery. Appendicular artery, which is actually supplying the vermiform appendix. So let's see some of the pictures of these arteries. This is the picture of the artery supply of the heart, where we can see that the right and the left coronary artery is anastomosing with each other in the different places, like the branches of the right coronary artery, that is the posterior interventricular branch, is anastomosing with the anterior interventricular branch of the left coronary artery. So they are actually anastomosing with each other. At the same time, the right coronary artery itself is anastomosing with the circumflex branch of the left coronary artery. So whatever that is, this anastomosis is happening, but still the main point is that if this right coronary arteries get blocked, then due to this poor kind of anastomosis, the left coronary artery will never give sufficient blood supply to the area of the right coronary artery where it was supplying. So even the anastomosis there, which is not functionally significant or sufficient enough, that is the point of the functional end artery. And this is the artery, which is the appendicular artery, is a branch of the ileocholic artery. So this is another type of functional end artery. This is the circle of Willis that is present at the base of the brain, where different arteries like anterocerebral, medial and posterior cerebral arteries, and also the internal carotid arteries and the vertebral arteries are anastomosing with each other. But still, if any of the arteries getting blocked, it is impossible for the other arteries to giving the blood supply to that particular area, and that's why the myocardial infarction is happening in the heart due to the lack of artery supply. When the arteries are blocked, at the same time stroke can happen in the brain if a particular artery is blocked, because even they are connected with each other or they are having anastomosis, but which is not functionally sufficient enough. This is the nutrient artery. As we can see, the nutrient artery is supplying in the different places of the bone, but still if this nutrient artery is still anastomosing with the epiphyseal and the metaphyseal artery, but still if the nutrient arteries get blocked, the epiphyseal and the metaphyseal artery are not sufficient enough to supply the places where the nutrient artery is giving the supply. That is the focus. Now in this picture we can see the thing in the simplest form. This is the anatomical end artery or the true end artery. We can see that these two arteries are not connected with each other before going to the tissue. So if this artery is blocked, the whole area of this tissue will be necrosed. That means lack of blood supply or ischemic necrosis can happen. But these two arteries are having a precapillary anastomosis. But still, if this artery is blocked, these arteries are not giving sufficient blood through this anastomosis to that area, and still this area is necrosed. So that means even they are having this anastomosis or connection, this artery cannot supply sufficient amount of oxygen containing blood to this tissue. So this is actually present, but it is not working that much. So this is the functional end artery. In your exam, you should give this figure while you are answering the true and the functional end arteries. Now, what is Vasavasoram? These are the minute blood vessels which supply nutrition to the tunica adventitia and the outer part of the tunica media of large arteries or veins. Source: these minute blood vessels come from either branches of the same artery or from neighboring arteries. Formation: it breaks up into capillary plexus within the tunica adventitia. The venous blood from the plexus drain into the vein which accompany the artery. Examples: coronary artery arising from the aorta is one of the best example for the Vasavasoram. Special note is that Vasavasoram supplying the veins are more abundant than that of arteries, since venous blood exerts low pressure and Vasavasoram can approach close to the intimal wall. So what is actually written over here? Let's do some analysis. First of all, you know that the large artery or the large veins are having very thick wall. That means the tunica media, tunica externa, and the tunica intima, whatever that is, they are quite thicker than that of the muscular artery or the small arteries. So how they will get their blood supply even they are containing blood? How is the blood supply happening of a artery, large artery especially, which wall is quite thick? The thing is that they are having oxygen from the luminal blood. Most of the arteries are having oxygen from the luminal blood. That means the blood which is flowing inside their lumen. But we know that large arteries are having very fast blood flow inside their lumen. That means the blood is flowing so fast within their lumen that they are not having sufficient time to absorb nutrition from this fast flowing blood. So if still they are absorbing some of the nutrition, those nutrition can reach up to the tunica intima and some part of the tunica media. But those nutrition is not sufficient to go up to the tunica adventitia, which is the outermost layer or the outer half of the tunica media. So don't you think that the outer layers are not having sufficient oxygen or the nutrition? So how they will get the nutrition? Because the tunica media and the adventitia is not getting sufficient blood or sufficient oxygen or nutrition from the luminal blood. They are having extra blood supply, and those blood supply is coming from the small blood vessels, which is coming from the outside, and they are entering from the outside. They are entering through the tunica adventitia and they are going up to the tunica media. From where these small blood vessels are coming to give the blood supply of the larger vessels? These vessels, small blood vessels, are mainly coming from its own. That means the artery which is having this problem, that artery is giving the small blood vessels by its own, and those small blood vessels is re-entering into its body, that means its wall, to give the blood supply. Or those small arteries can come from the another artery, that is neighboring artery. It's like you are feeding yourself. That is the Vasavasoram. Let's see a picture. This picture is drawn by me, and you will never get this picture from any books. So you have to draw this picture, because while you are answering the Vasavasoram, as a short note in your exam, you have to be very much cautious that you have to draw this picture. You can see here, this is the tunica adventitia, the blue area, then the tunica media, the thicker area, then the tunica intima. What is actually happening over here? A small blood vessels is coming from these blood vessel, and it is going outside, and then it is re-entering in its wall to give supply, and it is forming a plexus over here, and this is called the Vasavasoram. This is a small blood vessel is the Vasavasoram. At the same time, these small blood vessels can come from another vessels, that is neighboring vessels. What is the function? They are actually giving blood supply to the tunica adventitia, and you can see the outer half of the tunica media is having the nutrition from these small blood vessels, which is actually coming from the mother blood vessels, and this is the Vasavasoram. Now a very easy layout to understand the classification of the blood vessels. Our main focus is on the arteries. Large artery, anatomically they are functionally called conducting artery or conducting vessels, and histologically they are called the elastic artery. Medium size artery, they are functionally called the distributing vessels, and histologically they are the muscular artery as well. Small arteries, they are functionally resistance vessel and histologically muscular artery. Arterioles are also resistance vessels, and structurally or histologically they are having very thin layer of muscle. Then capillary and sinusoids, they are basically exchange vessels, they are having only the tunica intima, that means endothelium with the basement membrane, and a very thin layer of the connective tissue. In case of veins, it is quite similar to the arteries, like large, medium and small size artery, and they are basically capacitance or the reservoir vessels, because they reserve blood inside the lumen, and most of them are the muscular vessels, and veins are sometimes having valves. In this picture we can see the comparison of the artery and the vein histologically. You can see this is the elastic artery, where this is the tunica adventitia, tunica media and the tunica intima, and over here we can see that this is also a large vein with tunica externa, media and intima. Then the muscular arteries are quite same, but we can see that the muscle of the arteries, that means the tunica media, is quite thick than the vein. Then the small arterioles and the small venules. Over here we can also see that tunica externa and tunica intima is here, but very thin layer of muscle layer can be present over here, that is the tunica media. But most significantly, in the venules, the endothelium covered by a connective tissue layer or the tunica externa is there. But on the other hand, in the arterioles, even the endothelium with connective tissue is present, but still smooth muscles are wrapping around the arterioles, which is very significant. Tunica media is very profuse. And then capillaries, we will discuss the capillaries on the next slide. So we will discuss capillary in the coming slide. For today we have discussed about the Vasavasoram, and also most important topic for your exam, that is the end artery. So hopefully you have understand it. I have presented this informations in a very short way, so that you can get sufficient time to finish this thing. Thank you very much, and if you have any queries regarding the topics I have discussed today, feel free to ask me in the comment section or in the messages. Thank you very much. Take care.